Hello everyone. I hope you all are doing well. Welcome to your YouTube channel, Your Path from BDS to DMD. And as promised, we have another lovely, very humble, and a really experienced doctor, Dr. Nuba. Hi, Dr. Nuba. How are you?
I am good, Dr. Jasmine. How are you doing?
I am doing great. Thank you so much for being so kind and spending this time so our viewers can learn from your experience and you can give them some positive vibes, some positive thoughts on how they can get into a dental school. So,
Of course, of
um,
course. Thank you for having me today. I would love to help anybody and anyone.
that is very kind of you. So Dr. Nuba got admission at the Tufts University School of Dental Medicine, and it is in Massachusetts. And I graduated from BU, and BU and Tufts are not even a mile away from each other. So I am super excited, hopefully, to meet Dr. Nuba and her family sometime soon.
Of course. I am excited to meet you too, Doctor.
So, Dr. Nuba, can you please tell us a little bit about your journey from your BDS, a little bit about your experience, and we will take it from there.
Right. I was raised in, I was born in the city of Gorakhpur, which is a small little town in UP. And I was very blessed to be able to go to a dental school, a professional school, because the part of the country that I come from, not everybody, not all girls are able to go to a professional school. So I feel very blessed that I was able to, and I graduated from Uttar Pradesh Dental College, and it is located in Lucknow, which is the capital city. So it was a great opportunity for me. I in the college itself, with all the different camps and all the different clinics and all the patient influx, because it was on the suburbs, and people, all the villagers would love to come and get all the treatment. So it was a kind of a very great experience. A lot of patients that we can treat, and from the morning to evening people are there. So it was kind of it happened to be a quite a great experience, for a learning experience for me. And then as soon as I graduated, I started working as a dentist in my city. And soon thereafter, I met my husband, and we got married. And he and I came to United States in 2009 December. And as soon as I came here, it was a whole different story, because as I was a dentist in India, it doesn't stand anymore, of course. But I did not give up it then. I saw there was a dentist. I came to Rochester, New York, and as soon as I came there, I found a dentist who happened to be my neighbor. And I just went into his clinic, and I told, listen, I'm a doctor from India. Can you please let me shadow you? And he was like, okay, let me see your degree. And I was like, okay, cool. And then he literally saw it, and he was like, okay, come on, doctor, you are on board. And so then it was I think for 8 months, roughly speaking, before we all started to have, we decided to have our family. So before that, as I got pregnant with my son, till that I was just, shadowing him. It was also and at that point I came to know how the United States clinic would work, because it was a very different experience from an Indian clinic, because dentist is everything in the clinic, and here we have a hygienist and a assistant and a receptionist, which is not the same thing in India. So yeah, it was quite a learning experience at that time too. And then as things went by, as life went on, I had kids, and I kept having kids. And I had 4 kids until 2017 basically. And along the way, I got busy with the family, for sure, with responsibilities, with husband, with the house, and with everything. And I just took a little bit of a push, and I wanted to focus on the family, raising my kids, of course, which I thought I did a very good part of it, because I was there for my kids when they needed me the most, because that's when they need you the most. They're little, they can't do anything.
Very
So
true.
I thought I did a good job by selecting that, that path. And but along the way, I that desire to be a dentist was always there because I was a dentist, and I kept at taking my boards. And so the NBDE part 1, it was a piece of the cake. It came like, like right away. And but with the part 2, I had a little bit of a hard time. I was pregnant at the time, and I thought I did not do a very good job at studying, I guess, and I wasn't able to pass the exam. So that came as a challenge, and then I gave up for a year before I was disappointed. And then I had a little baby, so I was like, you know what, I'm going to take a little bit of a break here and then go back to it. And then in 2019 I tried again, and I passed it. And so in December of 19 I passed my boards. And now as soon as I passed my boards, it was it. You are fully qualified. You have a TOEFL score, and you can go back. So I just applied to a bunch of schools, of course, and Tufts was one of the schools that I applied to. And I thought that it was a top 20 school, top 20 in the United States, and it's a great school. And given the diverse culture, the diversity, and I am a lover of diversity, I have traveled to so many countries with my husband along the 10-year period, that we love different cultures, different people, food, places. It's again, it's a learning experience to be able to go to different places, to be able to see how things work, the money, and even the currency is different in different countries. So it's all a learning experience. And Tufts is a diverse school, and I see like the faculty is from all over the world. So I thought that it was a very good school. And then the research programs that they have, I think that all the work that they do, I just recently read about how they were doing, they're funding programs that would help in opioid addiction. The families that are affected with it, they're helping those people come out of it, and which is all a great thing. And Tufts is a great school. So I think that I'm very, very blessed to be able to become a part of a Tufts family.
Nice. I'm very excited, and I think just for our viewers, there are a few, as I always say in all videos, there are always few take homes. So I think what we learned from Dr. Nuba, your first take home is diversity. So we all are very diverse, either whether it's our educational background, our cultural background, or even our circumstances. Like, some of us may be recent graduates, some of us may have families, some of us may be coming back to the field after 20-25 years. Some of us may be entrepreneurs who had our own practices, sold it, and came to this country. So I think the bottom line is believe in yourself. Do not compare yourself with any other applicant. Is that saying it right?
I think that is one of the biggest driving force that is important in a person, to believe in themselves and to keep working at it, and to make sure that you're not quenching that desire. That burning desire has to keep going. Like, okay, I need to get back. I am busy doing some very important things in my life, which could be anything in your life. Right. But the whole point is to, at some point, get towards your goal, get closer every day. So right. I think that's the right point. The burning desire and the constant wanting of the dentist that you have in yourself, you have to make sure that it's alive.
Correct.
So definitely, I agree to that.
Yeah, and I think the other thing which Dr. Nuba said is consistency and persistence. So if you really want it, you really get it. So make sure that if practicing dentistry in the United States is what you want, if you want to serve the community, if you want to serve the people who need dental help, if you want to bridge the gap of access to care, and if you love everything about dentistry, then you really have to want it. And as Dr. Nuba put it so well, that you have to take baby steps and you have to improve yourself every day. So instead of comparing yourself with a colleague or a friend or a junior or a senior, compare yourself how I was a month ago and how I am today.
And I absolutely agree to that point, because just as soon as I passed my board exam, the first thing that I did was like, okay, before applying to dental schools, I was like, you know what, in the state of Florida, I can actually get a dental hygiene license to be able to practice as a hygienist. And I was like, you know what, I will jump on it as soon as I found out. And then I applied right away. And this COVID thing hit and everything got shut down.
Right.
But as soon as they opened it, it was my chance. And I literally, we drove, my husband and my family, we all drove 4 hours to Miami to get this license, and we were all set.
Nice, nice. So I think there are two lessons to learn from this. Number one, if you remember, if you go a few minutes before, Dr. Nuba said they were in New York, and the next door neighbor was a dentist, and she asked. So the first thing is you always ask, and you know, you have to be persistent, but at the same time be polite. And I think you'll realize that, Dr. Nuba seems to be a really fun-loving, nice person who likes to just be in the dental field. So she was absolutely okay with just, shadowing a dentist and learning how dentistry in the United States may be slightly different than the country that we come from. So I think one thing, as she said, is the workforce. Here we are more used to working with hygienists and assistants and expanded function dental assistant. And the second thing is her, her desire to be in the dental field. So I know Florida is a state where you can take a dental hygiene exam, and if you're an international trained dentist, you can practice as a dental hygienist. And she took that step, and plus she beautifully managed to have children, have a family, and have that work-life balance, but at the same time still a desire that she needs to grow professionally. And I think that is the beauty of all these international dental programs is it's like it's a second chance to practice dentistry, to learn new technology, to learn new different ways to understand insurances.
In a better way, definitely. What I was telling you, that the patient influx of the villagers, because you are in suburbs, the college and suburbs, and everybody wants to get this free dental care that is provided by the students there. People are excited, they want to come, and they want to they want to learn. Everybody wants that, and especially if it's free, so that's always a boost.
Definitely. So Dr. Nuba, tell us a little bit about your dental hygiene license preparation in Florida, because I know a lot of people have asked that question on a lot
They
of
have
forums.
been, yeah, exactly. So people have been contacting me, and I have been telling the same exact thing, which I'm going to tell, that it's basically a 3-step exam. You need to make sure that you have notified the Florida dental boards about your NBDE results. Of course, you have to make sure that you have sent your report card to them.
Right.
And then your EC, of course, because they want to make sure that it is all converted. So those are the two things. When you notify a Florida board, they will give you the permission. The CDCA, they will notify the CDCA, and the CDCA will let you take the 8X exam, which is the exam for the dental hygiene. And then the 8X exam consists of 2 parts, basically. It is one of the computerized exam,
Right.
which is called a CSC exam, which is basically dental hygiene questions. How you have to answer 115 questions in 120 minutes. And very simple, very easy. If you have passed part board exams, it's nothing for you, of course. I mean, you can be sure about it. And then of course the 8X clinical exam, which I think my life became really, really easy because of the fact that they started a mannequin exam. And the mannequin exam is like absolutely, I mean, the calculus they have is really, really very, very, it doesn't come out, I guess. I mean, you have to really, really work on it, but it's better. I mean, with the patient, with no patient, and the fact that you don't have to get the patient verified that you have the qualifying calculus is a positive, which actually was a positive for me. And I actually, it came as a blessing for me that I was going to take an exam on a mannequin. Nice. So, and it really helped me. So that's how I passed my 8X clinical, the CSC, which was, because of the board, it became easy. And then the final exam, if you are going to practice in the state of Florida, is the Florida law exam. Right. Which is another small exam which will tell you about insurances, about what duties you have, what is what is basically what is if you can work something in front of the dentist, and or the dentist is away, what kind of duties you can perform. So it's essentially not a very complicated exam by at all. You just have to know a little bit about it, and there are so many slides available. And I would tell you guys that anybody, any dentist, any dentist who is from another country can do it very, very easily.
Nice, nice. So basically, I think to summarize is that in Florida, you have two parts of the exam, the clinical and the theory. So the theoretical part is where you take the computer exam just like a national board, but it has 115 questions and you have to answer them in about 120 minutes. So I want to say 1 minute, one question approximately.
One question, yes, correct.
And the clinical part is comparatively easy because what Dr. Nuba said, it completely makes easier, because sometimes especially when you are not yet a licensed dentist, it's difficult to convince a patient unless it's someone from a clinic you're working as a dental assistant, or it's a family member.
Correct.
So the mannequin part makes it easier.
Makes it really easier. And COVID has been a boon to us. I mean, in certain ways, of course, it has been a boon, but I'm sure in other ways it has not been.
Right. I think the pandemic has changed things in a lot of ways that is making us think of certain procedures, policies, not just in dentistry, I guess overall. And I'm really praying that things normalize soon.
I know, everybody is. Praying. Everybody is. Yeah.
And then she also mentioned that there is another exam, a third part, which is the
Florida
ethics
law
and jurisprudence, or the Florida law exam. So I think based on what Dr. Nuba said, it looks like that particular exam wants to make sure that you as a dental hygienist know where your clinical authority stops and where the doctors starts, because yes, we are international dentists, but with the hygiene exam, you will be practicing as a hygienist.
Correct. Absolutely. Yeah.
Perfect. So that is going to help a lot of people and I think if I am not wrong, I may have to do a little bit research, but I think Florida is the only state where you can practice as a dental hygienist without going to school. Most other states,
I think Florida for sure. I think there are other states, but not a lot. I'm not sure, because I was in Florida, so it worked out perfectly for me.
Right. Yeah, that is something I have to do a little bit more research. And I think most other states, you have to go to school for like an associate's degree, maybe like a master's. But Florida, in that way is it's an excellent state. And I was in Florida for a couple of years, and I think I missed the warm climate, when you come to the Northeast. But the good thing in the Northeast is you look forward to every season, because in summer you can wear dresses and cute flip-flops, and in winter you can wear boots and coats. So I think everything, it's a mix.
It's a give and take for everywhere, right? Everything has positives and negatives.
Yeah. So Dr. Nuba, I know you did mention that for you, National Board Part 1 was comparatively easy, and I would love if you can please tell our viewers that how did you study for Part 1 and Part 2? Because I know during Part 2 you had family priorities, but if you could please tell them what you used to study. And again, I want to make this very clear to all the audience. It's not a paid promotion. These are our views. It's what we have used to study, and everybody may have a different style. But I think if you share that would be very helpful.
Yes, of course. I mean, it was, we all know about dental decks, and that is the basics. I mean, if you know your decks, then you know everything, almost everything. And then the YouTube videos, I found them to be really, really useful. I think what happens is that, suppose just an example, like a temporomandibular joint, you want to get like the whole movement of the mandible properly, like, okay, how does it really work, and how does this gliding and sliding happens? And you go there and you just look at those videos, and then you go back to Dex and you just go and read it. And then it just makes it so, the picture so clear that you just don't need anything else. You have the Dex, you have those videos, you go through them. And I mean, I thought that NBD part 1 was super easy because we just have like 4 or 5 subjects in there that you are given an exam on. And this part 2 is more subjects, of course, and it's more clinical. And then there are 2 exams that you have to take. Of course, everybody knows that as a exam giver of NBDE. So it becomes a little bit, it became a little bit too much for me for the first time, but then the second time it was fine, and I was able to do it. So it was okay. But then again, for the part 2, I would again say the Dex and Tufts Pharma is for pharmacology. There's nothing else that you need to know in pharmacology other than Tufts Pharmacology, and which I am happy that I read, of course, given that I'm going to Tufts. And then and the videos and the mental, I especially found the mental dental videos to be really, really good.
Yes,
I thought they had all the contents. I mean, mostly the contents, mostly subjects that are like prosthodontics. They have a lot of videos on that.
Right.
They have periodontics, a lot of videos on that. So they have like particular subjects that you have a lot of video. I mean, I don't think they had at the time when I was studying last year. I thought that they did not have all subjects, but whatever they had, it was good. And then, you know, for the pedodontics and the orthodontics, you don't need that much information. It's all in the Dex. So you can just pretty much make sure that you know your Dex.
That is good to know. So I think what Dr. Nuba said, and I really like it. I think she's a visual person like me. So even for me, you know, if somebody gives me something to read, and my husband is also the same. If we see a video and an audio, I think, and especially the animated ones, I think we tend to remember it more than if you just give us a textbook to read.
Yeah, definitely.
So, Dr. Nuba, tell us, what made you choose Tufts? Why Tufts?
As I was telling you before about when I was looking into schools, and I was trying to apply to schools for going for the DMD program. I was essentially, not that I'm scared of bench test, but it is one of those schools which does not have a bench test, which it makes it easier a little bit, that you don't have to actually work on a cavity. I mean, although everybody gets ready for it anyway, because, you know, you never know which school invites you. Right. But so that was one of the things. And then being a citizen of United States, I feel Tufts definitely is one of those schools who will value the fact that you are a US citizen. So I, for that reason too. And then with the diversity of the university, and then of course the research programs, and it is one of the, you know, it's one of the renowned like top-notch schools in the country, and everybody would like to go to it. Yes. And when and now that I know now that I have given the interview, and now that I've talked to Dr. Perry, and he had this amazing program of going to Appalachian Mountains, and he would go there for 3 days, and he would provide free service to the people. Wow. And which was, yeah, and and it's amazing to see that, because when I was in India, that's what we did in the camps. We would go and, you know, kind of go to the villages, make sure and inform them ahead of time that we will be there for those 2 days. And then we will see hordes of people coming in, wanting to get those dental treatments for free. It's cleaning, it's okay, some fluoride, you know, and it will be, you know, you tell them like these things, like it will help you not have a cavity. And they will be like, oh, wow, really? And then they will get it on. And so it is kind of the same. And I was like, wow, this is really, really good. So I realized Tufts is a great school. So yeah.
Nice. So I think you know, this is another take-home message for everyone who is listening, that, as I always say, choose a school, because just like the school is choosing you, you are also choosing the school. And you know, as Dr. Nuba said, that with a lot of faculty, her volunteering experience and her experience in the past from her home country resonated with what a lot of faculty at Tufts were doing. So, you know, that's where she's like, okay, this is a place where I'll feel comfortable. You know, this is a place I can call home again. And I feel that is something which is very important. She also mentioned that it's about the research work, and then Tufts is among the top 20 universities in the country. So one take home message here is do your research.
Do
Know
your
your
research. No, yeah.
university well,
Yep.
because
Yep.
we all know the application process is consuming, and time wise, financially, and also emotionally, like applying to so many schools and understanding. So I think um, what I would suggest is look at all the schools and try to see where you find yourself as being a part of the school culture, because every school has like two different families are different. It doesn't make one family right or the other not. It's just which family you want to attach yourself to. And I think that is something very important for you. So if research is something that interests you, then that's a school that you take. If more hands-on clinical, then there is another school. So I think you
And
need
I
to
would
choose.
I would add one thing, Dr. Jasmine, here, that if you had been a part of a research, I mean, you can always, you have one opportunity to tell that, okay, I had done this research and I'm very interested in a research program that I would like to join this school, because, I really want to be a part of the research program, or I want to be a part of serving the underserved, or it is all how you feel connected to a school. And that's also an important part, of course. And once you get an invite, you are going to be able to answer the questions more realistically, because it actually connects to you in some ways. So that is also very important, I think.
Definitely. So we come back to our same point again, that be genuine, be authentic, because people who are interviewing you, sometimes your age is their experience. That's how much experience they have.
Absolutely correct. Absolutely correct.
Um, so, Dr. Nuba, what are some, I know you did mention your choice for Tufts, but then what would be a few tips that you would like to share for someone who is thinking, of going to Tufts, or let's say someone from the audience gets an invite from Tufts. So what is it that they should prepare when going for an interview?
They should focus. I mean, when before you apply, of course, I would tell you the first thing is your SOP, which is the statement of purpose. It is the one thing that defines you, that tells you who you are. And I think that is, and I feel that writing your own story is very important, because no one can write anything for you, which is because it's your life, it's your things that you want to put together, and nobody can put it for you. So I would tell people, I would encourage everybody that people write their own stories, and they can get the grammatical help from people. Of course, you can correct your grammar and your English, but the story has to be your own story. And knowing that I got accepted at Tufts, and I believe that your story matters a lot. I mean, not that I'm not by any means a great candidate. I had so much gap in my career, like a 10-11 year gap, and still I got a chance, because I spoke for myself, and I told them that I took a break for this reason, and I want to really, really come back to this. And I think that they overlooked my clinical experience lagging, I think, and that and I told them the right story. So which is why I think the SOP, it has to be an original one, of course. And then secondly, applying early in the cycle, I think that does really help you, definitely. I mean, you have to be prepared before March 3rd or 5th, whenever the cycle opens. You have to be like ready to go. I am all set here.
I
With
think
your
that is,
everything.
yep, that is a fantastic advice. So be genuine. I know there are a lot of services out there who are saying, we'll write SOPs for you, we'll write CVs
Yeah.
for you, and
Yeah.
I am not against anyone, but what I feel is when you write your story, you
It's
know it. It's like
genuine,
when
coming from your heart. It's flowing from your
exactly.
heart, and that's what you want to tell the person, that this is me, this is who I am, and I am hungry for this
Yes,
position. So I agree on that,
yes.
for sure.
That is so well put. You need to be hungry for education, and I think that is one thing which is very inbuilt. They say that when the student is ready, the teacher finds the student.
The teacher finds you. Absolutely. Or the teaches the student who wants to study.
There you go. There you go. So I feel it is absolutely okay to get help from your friends, your colleagues, people who know you, because I think what happens when there is a professional agency, and don't get me wrong, feel free to get their help, but I think make sure that it's your story, and don't get help in like as if just give them the assignment. If you write exactly what you feel like, and as I've always said, if you don't know how to start, take a pen and paper, literally keep it in your purse or your wallet, wherever you're sitting, wherever you go, whosoever you're speaking, talk to your 5 best friends and ask them, hey, what do you think is my strength and what do you think is my weakness? And believe me, friends are blunt, and I love my friends for that. Friends are always
Absolutely.
honest.
Yeah, yeah. Or it can be your husband.
Oh, that's epitome of honesty, believe me.
Exactly.
So, this is coming from 2 married women. So I can tell you that, and both of us have been married for about 10 years. So,
10 years, exactly.
so I think be genuine, be authentic. If you don't know, just think of it. When was the first time you went to your dentist? Or what is it that, made you go to dentistry the first time? Even something as genuine as, because I know I was reading somebody's CV the other day and somebody's SOP, and they really gave a very honest answer. They're like, they wanted to go to med school, but because of the grading system, they lost the seat for like 0.1% of marks, and then they had to take up dental. But as they started with the dental school, by the time they came to their D3, which is like the 3rd year of dentistry, and started seeing the clinical aspect of it, they fell in love with dentistry. And the person very nicely said this was a boon in disguise. And he actually got accepted in one of the schools. And I feel it was the genuineness, the authenticness of his SOP, which the person who was reading it felt it. So write whatever is yours. I actually read a very funny SOP a few years ago, and it was very cutest SOP. He's like, as a child, my both grandparents had dentures, and my job every night was to help them wash their dentures. And he said, as a child, I always was intrigued by the fact that how is this made? How can they have different teeth than mine? And that's why he went to dental school. So I think it has to be authentic, it has to be genuine. And as Dr. Nuba said, that she did have experience gap in her CV, and she explained it well, that family was a priority for her at that time. And one very beautiful thing about this country is, and this is something I feel, they respect you for who you are. If
Absolutely, I agree. Mm-hmm.
They understand that family is a priority. Most people I have met with, I felt my professors were more culturally sensitive than even me sometimes. Like, I mean, sometimes, so coming from India, like we have 26 different languages, and in our heads, somehow we just assume that the language I'm speaking, someone from India, just because they are from India, would know the language, and I just assumed it. Until a few years ago, I got this from a professor where he said, don't you guys have different languages in your country? And I'm like, oops, so I feel if you're genuine.
People are aware here. They're aware, they're educated. They want, yes. They want to know other cultures, other countries.
Yes. So, and it's gorgeous, it's beautiful. And I feel it's a very nice melting pot, because we all come from very different backgrounds. Some of us may have PhDs, some of us may have masters, some of us may be recent graduates. Some people I know had 25 years of experience and decided to move to US because they felt it's going to give their children a better future here. And as Dr. Nuba said, that she got married, and at that time, she had to maintain the work-life balance. And she decided that, okay, my family is my priority right now. But now that, the kids are
Going to
slightly at
school,
age.
everybody is ready to start school, and it is going to be definitely easier. And especially they're at that stage where they don't need mama for all the time.
Correct.
Which is like the initial years where you are feeding the baby, you are taking care, you are changing the diapers, you want to be with them, learning, making sure that they're learning the good things, trying to eat well, trying to drink properly. It's a lot as a mother, and I feel happy that I was able to do all of that, and then get lucky enough and be blessed to be able to come back to my profession. I really feel very, very happy and blessed.
Yeah, so I think that's the beauty of advanced standing program. Now there are going to be 5 people in Dr. Nuba's family going to school.
That is true.
So, Dr. Nuba, you did speak about the interview process. So Tufts just has, did you go through one interview? Did you go through multiple interviews? How does Tufts interview
it
process?
was just a one-day interview. They had 17 people in the batch, and it was from 9 to 2 basically. They had student panels, and it was actually very well organized. I would tell you that I felt like everything was very well organized. They had this, the different room settings that you can go to, and you were connected to this room and that room. And then so we had 2 set of interviews, one with the DIS program head, who was Dr. Ron Perry, and his was a 10-minute one-on-one interview, and then with a faculty and mine was with Dr. Wallich. She is in comprehensive clinical care, and she was, and it was a longer interview. Of course, it was like a 20, 25, 30-minute interview. And if both of them were, it was an experience. I mean, it was good. It went well, of course. Nice. As I got accepted, I'm going to say that. Dr. Wallich asked me an ethical question about how I would try to talk to a lady who has no insurance, and I get to see her in Target. And so I think she liked my answer, so she accepted me.
Very nice. Nice.
But other than that, a preclinical assessment, which was like basically acceptable and non-acceptable cavity preps and composite fillings. That's it. That's all it was.
So I guess just like a lot of universities right now substituting their bench test, I think Dr. Nuba just had one of, not an actual hands-on bench test, but what bench tests have become now the new norm.
Yep, absolutely. That's what Colorado did. Nice. And that's what I came across too. So, yeah.
Nice. So I guess the schools are definitely judging, that is a criteria. So there is definitely a clinical aspect, but they also want to see that how you would handle different situations.
Yes, there will be a question that you do not know of, and you have to make sure that you are calm and able to compose yourself. And there's no right answer, of course, right. But it has to be an answer that would make sense, right. I guess.
Nice. So, Dr. Nuba, tell us, what would be your take-home message for students who are applying, or students who applied a few times or have taken some attempts for the boards? Like, what would you like to share with them?
From my experience, as I have been accepted to a school, I know, and I had attempts and boards, I would tell that it does not matter, because as long as you have passed it, you are qualified. Then it could be one of those factors where, okay, maybe you would not get an interview in certain schools, but I'm telling you this, you have to believe in yourself, and keep trying, keep at it always. Be sincere towards your goal, and always be thankful for everything, which is a very important part of a person's personality. And if you are persistent, of course, and in my case, I'm a Muslim, so I'm very thankful to my Allah that He has blessed me way beyond that I deserve, I guess. And I feel that that thankfulness and that persistence, that driving, and as I said, the hunger and the desire, that burning desire to get somewhere is what leads us to our destination. And failures comes, of course, in everybody's life. There are failures, and I had mine. But the point is to keep yourself together, keep yourself calm, and make sure that you come right back to it. Yes. Because giving up should never be an answer. Yes. As Dr. Wallach herself in my interview, she said, how do you handle stress? I said, Dr. Wallach, I handle stress by just, when I am stressed, I go back and then I come right back to it. So that's how I beat stress. So yes, stress is a part of life. I would tell everybody, stress is in everybody's life. You are not alone. Everybody has stress in some way, shape, or form. But what we need to do is be composed, be patient, be calm, and keep working towards your goal. That's it.
That is such a nice take-home message, that first, be grateful and thankful for what you have.
That is absolutely the first thing that you need to do. And whatever religion you follow, you have to be thankful and grateful to the superior powers above you. I feel it is very, very important. Yes. And then only then you get that courage and energy to be able to pursue you towards your goal, I think.
Yes, definitely. I agree with Dr. Nuba. And I feel they say, right, abundance attracts abundance. So if you're thankful and grateful for whatever you have, I think then you start attracting more things. So thankful for small things, like you could be in the United States, so you can take your national boards anytime, or
exactly.
You have a family support for you. Thankful that we woke up alive, thankful that we are happy, thankful that we are healthy. And I am thankful right now that doctors like Dr. Nuba are helping us understand and helping us understand their journey, walking through their journey, and giving some positive thoughts. So believe there is a universe that is watching your back. And as Dr. Nuba said, believe in whosoever, whatever power you believe in. Some people, for them, their parents are equal to God. And I feel, that is absolutely important, because they are the ones who've always watched our back. For some people, I feel the universe has abundance. You have to believe in yourself. And that's one thing which I keep telling people. It's absolutely okay to have knowledge and gather things as what's going on in which school, but don't get disheartened because somebody tells you that, oh, this was my interview, this is what they asked. And if you don't have those checklists in your resume, that's not going to change things for you.
There is no right SOP. There is no right grade. There is nothing. You have to just believe in yourself and keep praying that one day it will come true for you.
Exactly. And as Dr. Nuba said, that try improving yourself a little bit, because, we all have room to get better. And when I say get better, it could be like simple things. So for me, I like to learn a little bit more about, let's say, particular clinical aspect in dentistry. Go to YouTube, find some videos, and learn. But what you were today and what you were tomorrow, it should always be a nicer and a better and a more stronger version of you.
Absolutely. Agreed.
Mm-hmm. And as Dr. Nuba said, that everybody has their share of happiness, but everybody also has their own share of hiccups. And I feel, this is something I believe in, that whenever there is a hiccup, you know why hiccups happen, right? When food goes in the wrong pipe. So be thankful there is food.
There is. Yes, absolutely.
I am a bigger believer of glass always half full. And I always feel even if glass is fully full, I can always add a little bit of coffee and it will really taste good. So let's stay positive. And as Dr. Nuba said, that every applicant is different. She used a few specific websites and YouTube channel, and I'm definitely going to put those in the description box so you can refer it to them. And as she said, that invest time in studying. And now that with the integrated national board, things are going to be, different. But what I feel at the end of the day, the basics still remain the same.
Exactly. The dentistry is going to be the same.
Exactly. So thank you so much, Dr. Nuba, for your time. And just so that everybody knows, we are recording this video almost at 11 o'clock at night, because that's when both of us got time on a Sunday night. So we are very eager to help anybody and everybody who can. We feel even if one person can benefit from this video and can get into a dental school or any school of their dream, I think it is worth our time.
It will be totally worth it.
Thank you so much, Dr. Nuba. I look forward to seeing you hopefully very soon.
Of course, doctor.
And
you have a great night.
Thank you, and I wish you all the best for a very beautiful future. You're going to be a great doctor the second time.
Thank you.
You're already a good doctor. You're going to be a greater doctor.
Thank you. Thank you so much. I appreciate your kind words.
Good luck and lots of hugs and blessings to your little ones.
Thank you so much. Thank you. I appreciate it.
All right, everyone, please stay tuned. We will definitely bring you a few more videos, and please like, share, subscribe, and please tell your friends, anybody who needs any kind of information about dentistry or dental school. You can visit us, send me email, write your questions in the description box, and I'll talk to you soon. Thank you. Take care.